You're welcome to Demi Care, and my name is Abidemi Adamson, and you're welcome to our channel where we talk about medication and how to use them properly. All right, so today we are going to be talking about metformin. So if you are taking metformin, most likely you've been diagnosed for pre-diabetes, or you do have active diabetes. So this is depending on your A1C. So if your A1C is higher than normal, then they will have you taking diabetes medication. Usually they will prescribe this if your A1C is about 6.5 or more or higher. Usually if patients are about 5.7 in their A1C or about 6 in their A1C, then it's considered pre-diabetic. So they would have you taking some starting you on the metformin. All right, so this is one of, like I said, one of those first medications that's prescribed for patients who are newly diagnosed with diabetes. It's also used in patients who have PCOS as well. PCOS is like polycystic ovarian syndrome. Apparently it helps with that. And also if the patient has pre-diabetes, or if the patient is trying to have a baby, they'll prescribe it as well, just to kind of help the patient. All right, so usually the patients would get started with metformin at about 500 milligrams twice a day. All right, so the maximum dose for metformin is about 2,000 to 2,550 milligrams. So usually they'll keep you within that range to keep your blood sugar in check. All right, so the metformin comes in different formulation. There's a regular formulation, there's an extended release. So usually they'll prescribe the extended release if you're having more stomach side effects while taking the regular metformin. All right, so how does the metformin work? So I know you guys want to know how metformin works. So what it does, it decreases glucose production. So what it does is it tells your insulin, like, wake up, insulin, like, you need to stop all these glucose from all these foods, stop them from going into the blood. So we need those glucose for as our energy source, and we want to keep them in other areas other than the blood, because when it gets in the blood, then that's when patients start getting high levels of high blood sugar, and that's when they start getting the diagnosis of diabetes. All right, so it usually it kind of helps decrease the absorption of glucose in your stomach. And also, in addition to this, it will decrease how well your body absorbs vitamin B12. So our stomach usually makes vitamin B12. So usually if you're on metformin for a long period of time, you have to take a vitamin B12 in addition to taking the metformin medication, because your body is not making enough vitamin B12. So what are some of the adverse effects of metformin? All right, so one thing about metformin is your stomach might go haywire when you first start this medication. So usually most of my patients will complain like, my stomach would not stop rumbling. Like, I'm having gas, I'm having diarrhea, I'm having abdominal cramps, so bloating. So these are common side effects when you first start metformin. So especially the regular one. So when you first start the regular one, these side effects cannot be put to the side. It may occur, okay? So like I said, it's gas, nausea, vomiting, diarrhea, bloating, abdominal cramping. This may occur. If it gets very bothersome, then you need to tell your doctor to switch you to an extended release formulation, because the extended release formulation kind of helps with those side effects. So you get lesser of the stomach side effect with the extended release, and it's still actually doing the work that it's supposed to do, which is decreasing the amount of blood glucose in your body. All right, another side effect that patients complain about is they get this unpleasant metallic taste. I'm not sure why that happens. Maybe it's the formulation, but it's something to also look out for when you are taking metformin. Also, with metformin, you want to make sure that you're taking it with food. It's recommended to take it with food to also kind of reduce that stomach upset that you're having. Also, with metformin, you don't want to take it with too much alcohol. So alcohol is something that you want to run away from if you are taking metformin, especially if you are the type of person that binge drink and you don't know your limit. Metformin is not a medication to binge drink alcohol with. Let me say it loud.
Metformin is not a medication to take if you are going to be binge drinking, okay?
All right, and also when you're taking this medication, like I said, if you are having those diarrhea episodes, then you want to make sure that you're staying well hydrated. And also, before I let you guys go, another severe side effect of metformin is lactic acidosis. So lactic acidosis can occur while you're taking metformin, and it's a condition that the symptoms include, like, unexplained hyperventilating, your breathing just, you keep breathing faster than normal, or you're having like a muscle pain, or you just feel weak, or you feel sleepy all of a sudden. If you are having those side effects and it's a severe one, then you want to reach out to your doctor just so they can check your acid levels and make sure that you don't have lactic acidosis. All right, I hope this video was able to help you all. Please stay tuned and make sure you hit the like and subscribe button if this video was very helpful, and also so you can get more educating videos whenever we post them. All right, thank you, and until next time, stay blessed.